So there's no doubt that in robust primary care, one of the major factors in that is patient's relationship with their primary care provider. It is the same person you're seeing, whether it's for acute care or your annual care. And we want that relationship to develop and continue to develop over the years. Direct primary care and Strada Healthcare relationship with your primary care provider, being able to reach them directly, has clearly been shown to decrease your utilization of urgent care, emergency room visits, and anytime you decrease emergency room visits, you decrease hospital stays. So it can be a huge hit and savings to the bottom line for both the employer and the employee. One of the biggest keys in healthcare is prevention. A great example of that is the robust set of labs that we do every year as a part of your annual exam. The cost of those labs is included in your care. Looking at many of those things at time and time again give us a continuation to follow in prevention, but also really help us pick up sometimes things earlier that we wouldn't otherwise have identified. And as a part of that prevention plan, developing a great relationship with your provider. We try to do that through our extended appointment time. So when you come in for your initial visit, we try to make sure that the provider has enough time to get to know you better, to cover where you're at in your healthcare plan at this point in time, but also to make sure that there's enough time to plan out what your future healthcare plan should be. That time in the beginning is really about building a plan that we come back to each year and plot where we are and where we're going, and maybe what we need to do differently. Time is a key in healthcare, and it can't happen in a 6 to 7 minute visit. So we try to make sure that every one of our annual visits is scheduled for at least 1 hour, and that there's plenty of time in that visit to take care of those things we need to take care of. Even urgent visits are 15 to 30 minutes at a time, so that we can get into follow-up of some of those other important things. This really does come back to even that relationship building.
One thing that we realized when we got Strada going 6 years ago was that the reason a lot of people didn't visit their doctor often was because there were barriers to care. It was cost. People didn't want to go see their doctor because they were worried about what is it going to cost me if I go see them, whether it's a copay or I've got a high deductible plan. And so we looked at direct primary care and we're thinking, this is going to eliminate all these worries that people have when they go to visit their doctor. Another thing that we think about is just the time barrier. Gosh, I'm too busy to go to the doctor. I've got all these things to do today. I'll put it off until tomorrow. And that's where the innovative things like our telemedicine that exist are so helpful to people, because they realize not only can they get care right now when they need it or get a question answered, but they can also talk to their physician. They can talk to their provider and know that there's a relationship there and someone that cares about them and knows them. So much of the care that exists in the world can be paid for directly, not just primary care. Examples of this are like imaging or prescription drugs, or even some like simple surgeries or outpatient surgeries make way more sense to pay for directly than running through insurance. And over the last 6 years, we've really worked to grow that list, not only to benefit our patients, but our employer partners as well. One thing we're really excited about announcing this year is expanding our cash price network outside of Nebraska. So we'll be able to offer cash price discounts again on imaging and labs and outpatient surgeries much outside of Nebraska on more of a national scale. One thing we're always thinking about at Strada is how can we deliver more meaningful insights to our employer partners. They invest money with us to be able to manage the primary care for their employees, and we want to be able to deliver to show them utilization data, to show them satisfaction data, to show them how are people utilizing this in a way that's benefiting your spend, but also improving their health outcomes. And over the years with Strada, we're always developing new tools and reporting metrics to be able to bring to our clients to show them that if you invest in primary care, there is a payoff there, not only from a financial standpoint, but also in the health outcomes of your employee population.
Strada Healthcare is celebrating its 6th year anniversary this year. And you don't get to 6 years as a new company without being very innovative. If you don't innovate in care, then all of a sudden as care changes, you're left behind. And that's very true for our business and for patients in getting their care. There are a number of things coming down the line with innovation in Strada Healthcare.
One of our goals over the coming years is to grow what we do beyond direct primary care and to be able to bring advanced primary care solutions to our employer partners and individuals and families in our communities. We're expanding our telemedicine coverage to anyone in all 50 states would be able to get a low-cost virtual primary care solution. Another thing that we've seen as super prevalent and needed in our society is behavioral health. And we're able to expand this now and be able to offer people across all 50 states 24/7 behavioral health, thinking outside the box with ways that we can work with employers, such as on-site and near-site clinics. We're grateful to the partners that have been along with us along the way, our employers and our members, and we're looking forward to another 6 years of innovation and bringing disruptive strategies to the primary care market.